So tell me honestly, have you ever opened a coagulation chapter and immediately felt lost? Factor 1, 7, 10, intrinsic pathway, extrinsic pathway. These are too many factors. And by the time you reach the end of the chapter, everything looks like an alphabet soup. And the worst part, even after studying for hours, many students still write a messy answer in exam and lose marks. But toppers don't memorize the entire chapter. They remember one flow chart. That's the topper strategy. One flow chart, one sequence, and one examiner-friendly presentation method. In this video, I will show you exactly how to write hemostasis and blood coagulation at the high scoring 10 marks university answer like a topper. Let's begin exactly the way toppers start the answer. Definition first. Hemostasis. It is the stoppage of bleeding after a vascular injury. In simple words, clotting it is the phenomenon where a shed blood loses its fluidity within a few minutes and converts into a jelly-like mass, that is a clot, to stop the bleeding. Now notice this diagram. In this, the fibrin form the meshwork in which the platelets get trapped, RBCs get trapped, and together they form this tight, unyielding seal which is called as a definitive hemostatic plug. Never start directly with the pathways. Always start with the definition, then diagram, and then mechanism. Now comes the part most of the students fear, the clotting factors. But don't memorize them randomly. Think of them as a players in a relay race. Fibrinogen, prothrombin, thromboplastin, and calcium. These clotting factors, these are nothing but the plasma proteins involved in clotting. They are numbered from 1 to 13. Out of these, the most important are 4. First, fibrinogen, second, prothrombin, third one, tissue factor, and fourth one are the calcium ions. These are the other clotting factors. Remember, fibrinogen, prothrombin, thromboplastin, and calcium. These are the 4 major players. Now the big question is, how do all these factors actually produce a clot? Let's see. The entire coagulation process can be reduced to 3 steps. First, formation of prothrombin activator, prothrombin to thrombin, and conversion of fibrinogen to fibrin. That's the whole chapter. Everything else is just detail of this step number 1. Now this clotting is an enzymatic cascade reaction. The term waterfall sequence is given by R.G. McFarlane in 1967. It is mainly triggered by 3 triggers. First, trauma to the vascular wall, trauma to the blood, and contact with the damaged endothelial collagen. As I said, remember only 3 steps: formation of prothrombin activator, conversion of prothrombin to thrombin, and conversion of fibrinogen to fibrin. Now this step number 1 is having 2 parts, extrinsic and intrinsic. Let's see which pathway is faster, intrinsic or extrinsic. Extrinsic pathway starts outside the blood vessel after a tissue injury. So whenever there is a tissue injury, tissue trauma causes a release of factor 3. Now this factor 3 along with factor 7 and calcium causes activation of factor 10 to 10A. And now this activated factor 10A along with factor 5, calcium and phospholipid forms ultimate the prothrombin activator. Remember this trick. Extrinsic is external injury, starts outside the blood vessel and fastest pathway. So whenever there is external tissue injury, it is extrinsic pathway. Intrinsic pathway begins in the blood itself. That is, a trauma to blood or exposure to subendothelial collagen or glass initiate this pathway. So the first activation pathway is activation of factor 12 to 12A. This activates 11 to 11A and in turn which activates factor 9 to 9A, which requires calcium. Now this factor 9A along with factor 8A and calcium and platelet phospholipid activates factor 10 to 10A. All of us know that factor 10A along with factor 5, phospholipid and calcium forms the prothrombin activator. Remember these factors, factor 12, 11, 9, 8 and 10. Here which factor acts as a cofactor? Factor 5A act as a cofactor here. Formation of thrombin. Now both the pathways merge here. The end product of extrinsic and intrinsic pathway is prothrombin activator. This prothrombin activator along with the calcium, it converts prothrombin to thrombin on the platelet surface. So remember here, thrombin is the star of coagulation because it performs 2 main actions. First one is a proteolytic enzyme. It converts fibrinogen to fibrin. And this also activates positive feedback. That is, it accelerates the formation of prothrombin activator by activating 3 factors, factor 8, 5 and 13. Remember this important, 1 ml of blood makes enough thrombin to coagulate 3 liters of blood. There is a clinical implication of this. Thrombin also activates protein C, an anticoagulant. So what is the key word here? No thrombin, no clot. Now the final step, that is formation of fibrin. This requires 3 sequential reactions. First, proteolysis. That is, thrombin converts fibrinogen to fibrin by removing 4 peptide chains. Next comes the polymerization. Here, these monomers join together to form the fibrin thread. And then the stabilization. In this, factor 13, that is the fibrin stabilizing factor, along with calcium, it creates a covalent cross linkages. Remember, factor 13, that is the fibrin stabilizing factor, it adds tremendous strength to this fibrin meshwork. Examiners love this point. Now, this meshwork traps plasma and blood cells to form the solid clot. After clot formation, the clot shrinks, and this is called as blood clot retraction. Within 60 minutes, this clot contracts to 40% of its original volume. As it shrinks, it squeezes off the fluid. This is called as serum. Important Viva question. What is a serum? So serum is plasma minus fibrinogen and clotting factors. What is the mechanism of action of retraction? Here the platelets play important role. Contractile proteins in platelets like thrombostatin, actin and myosin, it pull together the fibrin fibers and causes clot retraction. Remember, without platelets, the clot retraction is severely impaired. Now two important favorites for Viva. Role of calcium and vitamin K. This calcium is required for all reactions except the first 2 steps of intrinsic pathway, whereas vitamin K is required for liver to synthesize factor 2, 7, 9 and 10. In relation to calcium and vitamin K, 2 clinical aspects are important to write. First one, removing calcium with oxalate and citrate prevents the blood clotting in blood banks, whereas deficiency of vitamin K, it causes deficiency of factor 2, 7, 9 and 10, in turn prolong the prothrombin time and causes serious hemorrhage. Now, the role of liver and blood vessels. Here, liver has a dual role. It produces clotting factors like factor 1, 2, 5, 7, 9 and 10, as well as it produces anticoagulants like heparin, antithrombin 3 and protein C. In addition to this, it clears or removes activated procoagulants from the blood, whereas blood vessels in this endothelial, it secretes von Willebrand factor which initiates the platelet aggregation and tissue factor which initiates the extrinsic pathway, whereas smooth muscle vasoconstriction upon the mechanical injury. So remember, liver, it produces both procoagulants, that is factor number 1, 2, 5, 7, 9 and 10, as well as anticoagulants like heparin, anticoagulant 3 and protein C. You can remember this mnemonic HAP. So at the end, this liver failure causes both severe bleeding as well as dangerous unwanted clotting. As we have finished the first part of the answer, let's move to the second part, that is a major clotting factor deficiencies. In this, these are the different clotting factors and these are the conditions in which the deficiency occurs. Out of these 5 factors and their deficiencies are important. First one, factor 8. Deficiency of factor 8 causes hemophilia A. Deficiency of factor 9 causes hemophilia B. And deficiency of factor 11 causes hemophilia C. Whereas deficiency of von Willebrand factor, it causes von Willebrand disease. Now let's see in detail about hemophilia. Hemophilia A, it is also called as classical hemophilia. About 83% of the cases comes under this. The cause is factor 8 deficiency, that is anti-hemophilic globulin. It is sex-linked recessive, that is it affects mainly the males. The clinical factors are the person bleeds severely on minor trauma and bleeding into soft tissue like muscles, joints, it causes the severe joint damage. But the dangerous part is hemorrhage in the floor of the mouth, it causes suffocation. How is the lab profile in hemophilia A? Here, the bleeding time and platelet prothrombin time are normal, whereas clotting time and partial thromboplastin time is prolonged. Now let's see the sex-linked inheritance of hemophilia A and B. You can draw this diagram to show how the males are affected. Remember, the males suffer the disease and the female carry and transmit it. Now let's see other 2 variations of hemophilia, hemophilia B and hemophilia C. Hemophilia B is called as Christmas disease. It is due to deficiency of factor 9. It is called Christmas because it is found in a family with the surname Christmas, and it is inherited sex-linked recessive, exactly like hemophilia A. Whereas hemophilia C, it is due to deficiency of factor 11 and it is inherited Mendelian dominant. affecting both males as well as females. Remember, in all hemophilia, clotting time may be prolonged or normal. Thus, we have seen three hemophilia A, B, and C, which is due to deficiency of factor 8, 9, and 11. Let's revise the entire answer from the beginning. This is how we have started the answer of a long essay question. Started like a topper. Started with the definition, diagram, and then the mechanism. The mechanism involves clotting factors. Here the 1 to 13 clotting factors. Out of these, 4 clotting factors are important: fibrinogen, prothrombin, tissue factor, and calcium ions. After this, we have seen the mechanism of coagulation involving 3 steps: prothrombin activator, prothrombin to thrombin, and fibrinogen to fibrin. Here the first step has got 2 pathways, extrinsic and intrinsic. Then we move to the extrinsic pathway, which is starting with a factor 3. Remember, extrinsic is external injury, starts outside, and that's the first pathway. Then we will learn about the intrinsic pathway, starting with factor 12. Remember all these 5 pathways or 5 factors, 12, 11, 9, 8, 10, involved in intrinsic pathway. Then about the formation of thrombin, the role of thrombin in formation of clot. Remember, no thrombin, no clot. Then the fibrin formation, which involves 3 steps: proteolysis, polymerization, and stabilization, formation of fibrin clot. And lastly, the clot retraction, which tells us about the importance of platelet and its contractile proteins like thrombostatin, actin, and myosin. Let's have a quick revision summary to memorize for Viva. Coagulation. It is a plasma property. RBCs, WBCs do not participate. They just get trapped in the mesh. Extrinsic pathway. It is very fast and start with a tissue factor, that is factor 3. Intrinsic pathway. It is slower. It starts with factor 12 or contact with the collagen and glass. And lastly, common pathway, that is activation of factor 10A, formation of prothrombin activator, thrombin, and fibrin formation. And lastly, the serum. Serum is nothing but when if you remove clotting factors from the plasma. Some exam traps. Calcium is a factor 4, needed almost everywhere, whereas factor 6 does not exist, and vitamin K is needed for 2, 7, 9, and 10. Remember, revise this answer before final exam and then you are done.